My name is Carly Kano, and I'm going to perform a head to toe assessment on Maddox Rodriguez. He is a 13-year-old male, and he has already had his vital signs completed. I've already gone over a general survey with him. We've identified that he has no known medication or food allergies. He is not allergic to latex or anything else that he is aware of. He does not have any chief complaints today, no underlying history, no asthma, COPD, anything like that. He's never had any heart disease in his family. So we will just start with a general survey, head to toe, comprehensive assessment. The first place that you want to start with any assessment is just, the actual visual assessment of your patient. So I'm looking at his head, looking at symmetry, looking at his ears bilaterally, eyes bilaterally, nares bilaterally. Everything appears to be symmetrical. You would feel through the scalp, checking thinness, thickness of the hair, which could indicate a thyroid disease, bald spots, lice, anything like that, ringworm, something like that, and feeling for any knots, any asymmetry in the scalp area. Your hair's all messed up now. Okay, look at me. While you're looking at these things, you want to look at the eyebrows to make sure that the hair is evenly dispersed. I have to make accommodations. We've been on quarantine. I don't have access to an ophthalmoscope, an otoscope, or a tuning fork to be able to do a Weber and Wren test. I'll just do a whisper test to evaluate his hearing. And I do not have a Snellen chart, but I do know that he does wear glasses, and with his glasses, he has 20/20 vision. So moving forward from all of those exams that I can't really perform, I will verbalize my way through what I would normally do. So as I'm talking to the patient, I'm looking for eye contact, and I'm assessing whether he's alert and oriented to the situation. Can you tell me your name?
Maddox Rodriguez.
Can you tell me how old you are?
13.
Okay. Can you tell me where we're at?
Childress, Texas, Avenue H42 Northwest.
Okay. What grade are you in?
7th.
Okay. So basically that right there covers whether he's alert and oriented, he's aware of where he's at, and he knows what we're doing right now. So from that point, I have my husband's flashlight that I can use. So whenever I get ready to check the eyes, what I'm looking for is equal accommodation. So I'm looking to make sure that the pupils are equal and reactive to light. As I do this, I also want to test convergence and accommodation. Light, just look straight. Here you go. Okay. And then now I'm going to ask you to follow my finger without moving your head, okay? So testing the 6 cardinal fields, whenever you're doing this, you're testing the cranial nerves. You're looking at oculomotor movement of the eyes. Now look at my finger and look at the wall back here. Now look back at my finger and at the wall. Okay. And he's also able to follow my directions, which gives me a very good clue as to whether he's alert and oriented. So then I'm moving to the ears. While I'm looking at the ears, I want to feel on them, make sure the external auricles are symmetrical, they're soft, there's no abnormal skin growths, any flaking, scaling, anything like that. And while I'm looking here, I'm looking at his eyes, his conjunctiva, his glare is nice and white. He doesn't have any yellowing, pinkness, redness. And so at this point is when, I have a thermometer right here. I can kind of use it, but I would look at his ears and visualize the tympanic membrane, looking for any redness in the ear canal, looking for any kind of drainage, bulging, retraction, anything in that form or fashion. I would ask the patient, okay, now can you look up? I'm going to look inside of your nose. And I have a flashlight, so I can visualize. Bilateral turbinates are a little bit inflamed. He does have some mucus production. Like I said, we just came up off of quarantine literally Thursday. So we still have some symptoms, but we are having improvement of the symptoms, and we are not having any fever this week. Now, I would ask the patient, have you had any trouble breathing through your nose? Okay, can you cover one nostril and breathe in? Okay, other nostril. So that's just checking patency of the nostrils. Can you close your eyes for me? And tell me what this smells like.
Alcohol.
Okay, so I made an alcohol pad for him, and that's exactly what is on it is alcohol. You can open your eyes. Tested the olfactory nerve when we did that. I don't have a tongue blade with me presently, so if you'll open your mouth and say ah. At this point, I would be visualizing the tonsils to look for any exudate, any swelling, the uvula to make sure that it's midline, assessing the gums and the palate, soft and hard palate to make sure they are intact. Okay, you can close your mouth. And during that, I'm watching to see, is he following direction? Is he able to move his tongue freely? Does he have any dental caries that need attention? Okay, now can you open your mouth for me again? And I want you to stick your tongue straight out and move it side to side. Okay, now close your mouth and blow it up. Okay, big smile. Thank you. So that would be the assessment of the mouth, the oral area. And asking a patient while you're performing the assessment if they have any complaints in that general area that you're in case you are missing something. You know, if you do find something, then you want to go into a more thorough assessment of that area. If he was to, per se, gum pain or something, you know, which is something that he had while we were on quarantine, it was because of a loose tooth. It was not an abscess or something else that was going on inside of his mouth. So before we move on from the head area, that's when I would go ahead and palpate sinuses, temporal, frontal, maxillary sinuses. And now I'm going to ask him, can you open your mouth for me? Now close it. Okay, so we've tested the temporal mandibular joint. We're looking for any crepitus, any cracking, any pain or tenderness whenever he opens and closes his mouth, whether it stays midline and goes straight up and down or if it goes to one side. Okay, and now I'm going to go ahead and start palpating lymph nodes while I'm here. And while I'm palpating, I'm asking, do you have any pain? Have you noticed any swelling? Sit up straight for me and going all the way down cervical. And then while we're here, post-cervical, anterior cervical, lift your arms. I'm going to test the axillary. Have you had any pain or swelling in this area? Okay, you can put your arms down. Now what I want you to do is push my hand away with your face. Push it. No, not your head, your face. Like this. Push it. Push. Okay. Push. Okay. Now shrug against my hands. Shrug your shoulders against my hands. That's slouch. Shrug. Now push. Push them up. Okay. Good job. Now what I would go ahead and do, we're right here. Put your arms out for me. Okay. And I'm looking at his muscle distribution on his arms. I don't see any atrophy. Squeeze my fingers for me. Okay. Now finger dexterity. Can you do everything to your thumb? Pinky to thumb, ring finger to thumb, middle finger to thumb, index finger to thumb. Awesome. Now, can I have you put your hands on your legs, pick them up, flip them over, put them back down. Flip them over, put them back down. Awesome. Good job. Now, I'm going to hold my finger here, and I want you to go finger to nose, finger to nose, finger to nose, finger to nose, finger to nose. Okay, other hand. Great job. So that shows you the hand-eye coordination. It also shows that he is still able to follow commands. This time we're going to move on from the head and neck area. I could have him taste something to check, like COVID-19. That's one of the symptoms that was in this household, was that we had no taste and no smell. Generally, he was able to smell. I would assume he would not be able to, that he would still be able to taste, but you know, using something salty, you could still test that. The last thing on the face that I want to check is if you will close your eyes for me. I have taken a Q-tip and cut it in half. So I have a soft side and I have a sharp side. So I'm going to ask, tell me what you feel.
Soft.
Soft? What do you feel?
Soft.
Okay, how does this feel?
Sharp.
How does this feel?
Sharp. Soft.
Okay, open your eyes. Okay, that's fine. So he was able to feel, he has the sensation his cranial nerves are intact. Now at this time, what I'm going to ask you to do is sit up straight for me, okay? And I would ask him to pull his shirt up, and I would assess his abdominal area for any kind of moles, birthmarks, any kind of rash, bruising, open areas, sores, acne, anything like that. Can you turn for the camera so they can see your back? And so he has an absence of anything. His skin is clear. It's a normal color for his ethnicity. Go ahead, put your shirt down. Everything appears to be midline. Clavicular, shoulders, everything is lining up like it should. So I don't feel like there's any dislocation, any issues. He yawned really big, and I saw bilateral chest expansion. It's about 9 o'clock at night. I just got home from work. So what I'm going to ask you to do is sit up straight and lean forward with your chest pushing out. That's going to put the heart at a better angle for me to be able to auscultate it, okay? So right now all I'm doing is I am auscultating for heart sounds. He's got a strong rate and rhythm. It's even. It's S1, S2. I'll listen again, auscultate with the bell just to double check. Make sure I don't hear any murmurs, any gallops, any rubs, anything like that. Okay, and so while I'm here, I will just go ahead and start listening to lung sounds. Okay. Okay, out. You don't have to take super deep breaths. That's good. And then I would move on to the posterior chest. Sit up for me, which I know he hasn't had any respiratory complaints during all of this. He's just had a little bit of drainage from his nose. And listen in a ladder-like motion. Start here, here, down, here. And just make sure that you auscultate and listen to the full breath sound. Listen for anything at the base of the lungs especially. Okay. And at that time, if I was on the posterior or in the anterior and I hear any kind of abnormal, adventitious breath sounds, then I could further investigate it and I could tell him, you know, say the letter E.
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 99.
99.
99.
99.
99.
99.
So whenever you're doing that, it's going to help you to identify whether there's a consolidation that needs further intervention, further review. While you're in the back, if you feel like there might be some consolidation back there, you can also percuss. You'll sit up for me just a little bit. Turn facing this way. No, your body. Like, scoot. There we go. Okay. So you could lightly percuss in this area. And if you have an area of consolidation, it's going to sound very dull. If you've got that air in there, you're going to hear that hyperresonance. You shouldn't hear, it should just be resonant. It should be a nice, clear, thudding sound. You shouldn't hear like a dull, like there's something underneath it. Okay, you can turn a little bit back. So at this point, I would have the patient lie down. And I can't really move the camera to where you can see it while he's lying down. I want to auscultate the abdominal area, all 4 quadrants, listening for bowel sounds, making sure that they're either normal active or hypoactive, hyperactive. Anything abnormal needs further investigation. Percussing the abdomen, you can percuss for sounds of, you know, bowel obstruction, something like that is what you would be able to hear. And then once the patient lies down, you can go ahead and lay down. I just don't think they're going to be able to see much. You start at the mid-clavicular line here, and you draw an invisible line. You know, there's the clavicle here, and there's the axillary line here. So you start about right here and just percuss. And you hear that change right there. And so then you start at about the umbilicus. And there you hear it. It's like a tat 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 tat, and then boom boom. Did you hear it? So that's where you can percuss where the liver border is, and you can actually follow the edge up to get the span on it. If you can't really get a good identification on it, you can tell the patient take a deep breath in. Now release it. And he's actually thin enough and very muscular that I can actually palpate the very edge of his liver. It's just right up under the rib cage. Now, if you had any other issues, you can percuss over the spleen. You shouldn't really hear any difference noted when you percuss over the spleen. You shouldn't be able to palpate the spleen at all. If you have any indication whatsoever that this patient may have mono, you do not want to palpate the spleen. If you had any complaints of pain, you could do a light palpation and ask the patient, you know, how does that feel? Is that okay? Do you have any pain? And then if you get right here and they say, hey, that's kind of tender, you can do a deeper palpation of the areas. He's super ticklish, and ask if he feels any pain in those areas. If we thought that there might be appendicitis, left lower quadrant pain, right lower quadrant pain are indicative of those. We may want to test those, you know, rebound. Press in and it doesn't hurt, but as soon as you let go, then they have that extreme pain. That's indicative of appendicitis. And so while I'm here, I can go ahead and auscultate, which I would have already auscultated bowel sounds on him. I would, and for the sake of the video, and I'm probably going to run out of time recording, go ahead and auscultate. And make sure there's no bruit that can be heard, indicating aortic issues. You can auscultate femoral arteries here. You've got iliac here. He has no pain in this area. And so you can go ahead and sit up. Right there. So the abdomen part is done. There are further tests that can be performed if anything were considered out of the normal. Moving forward from that, we're going to move down. He's got no musculoskeletal complaints. The legs are symmetrical bilaterally. You can ask them while they're lying down to push against your hands with their thighs to test strength. Okay? And then I'm going to ask you, push against my hand. Okay? Pull against my hand. There we go. Push against my hand. Now pull against my hand. Good job. Now push against my hand. Push against my hand. Pull. Okay? Pull up. All right. And so basically that's testing the strength of the muscles. You can either have the patient lie down or stand up. He's young. He's very physically active. I can ask him, can you stand up for me? Go ahead and put your leg out to the side. Now put it straight forward. Other leg straight forward. This leg out to the side. Now cross them. Now cross the other leg in front. Okay. Bend your knees. Okay. Bend the other knee. Okay. So I've tested hip flexion. I've tested knee flexion, extension, flexion and extension, abduction, adduction. Go ahead and have a seat. I would palpate popliteal pulses. You can palpate tibial and then dorsalis pedis. Really, if you've got a warm and dry leg and you've got nice pink toes, if you're having a lot of difficulty palpating that pulse, it's generally going to be there. You just can't find it. If they're warm and pink and dry, that's indicative of a very good blood supply. But if you were in doubt, you could get the Doppler out and see if you can find the pulse that way. Oh goodness, sorry. I'm kind of limited on room. And it's getting a little warm in here. So from there, I would move on to reflexes for the patient. And the first reflex that we are going to check, this is kind of the first practice I've gotten to have with the reflex hammer. And so they said that on a flexed joint, it is easier to get a reflex. So I'm palpating for where the bicep tip is at, that it joins into the elbow, which is right here. And okay, and then have them sit up straight, relax for me, flex your arm, slightly flexed. Okay, we're going to try it. Okay, now we'll move down here to the radial. I'm checking this. I want to see that it is relaxed. The joint is slightly flexed. Go up about 3 inches from the thumb and the wrist area. And okay. You're looking for hyperreflexia, where it's overreactive to any kind of stimulation or no reflex whatsoever. And then there's the reflex in the popliteal area. Also, our patellar area, you want that joint slightly flexed. There's a little bit of stress on it. And when you swing the hammer, you want to swing it. Sorry. And you want to swing it. Okay. Get it right. There we go. And then it's kind of hard on this bed, but if you'll scoot forward just a little bit, and I'll flex the foot down here. Wait for a second. Flex the foot here, and then hit that Achilles area. I'm just testing for a reflex of any kind. Okay. Which, that's another rule of thumb. I mean, it's good to know all of these tests, but when I was practicing with the doctor at work, she told me you will know when you need to do a further assessment on a patient. You know, you need to know the basics, and from there, when you find an abnormality, there are X, Y, and Z tests that need to be performed. So at this time, I would tell him, go ahead and take his socks and shoes off, do a nice assessment of his feet, looking at the toes, my athlete's foot, that the toenails have been trimmed. There's going to definitely be an odor. He's mine, so I can say that. Okay. So looking at his toes, his toenails are trimmed like they're supposed to be. There's no flaking, there's no scaling of the feet, no indications of athlete's foot, no open wounds or sores. Oh, he does. He has a great big blister right here. What's up with that?
Skating.
What happened?
Skating.
Were you not wearing socks?
I was. But
Does it hurt?
no.
There's no indication. It's not inflamed. There's a little blister about 1 millimeter or so in diameter. It's just red. It has no exudate. There's nothing coming out of it at this time. It looks like it's healing. And he has stated that it's from rollerblading. At this time, if I had a filament testing, I could take it through here and I could check to make sure that he can feel. What's that feel like?
Itchy now.
Okay, go ahead and close your eyes and tell me, am I touching you or not?
No. Yes.
Okay,
Yes.
okay.
Yes.
Is that soft
Yes.
or is it sharp?
So
Soft or sharp?
sharp.
Okay. I'll just leave your sock and shoe off for right now. At this point in the exam, you could say, okay, go ahead and I want to see you take your foot and run it down the shin of your right leg. Now do the same with your right leg to your left leg. Okay, that's awesome. Stand up for me. Can I have you hold your arms straight out and close your eyes? Both arms. Okay, and all you're looking is that the patient is able to maintain balance. You always want to be there though, just in case they don't. That way if they start to go back, your arm is there. If they start to go forward, your arm is there. I'm going to try to push your arms down. Don't let me, okay? All right, good job. You can put them down. So now just walk back and forth right here. Okay, now I want to see you actually do a heel to toe. Heel to toe, heel to toe, all the way down. Okay, go ahead and have a seat. So he was able to perform everything that was asked of him. I'm trying to think now besides what I need to go over. So if you'll close your eyes for a second, this is just going to be one more test that I have for him. So if you'll put your hand out, I'm going to put something in your hand and I need you to tell me what it is, okay? So can you identify that object? You can feel it.
Battery.
Okay. Now.
Pin. Like a pin that goes on your shirt button.
A button. All right. Great. Good job. One more thing. Place your hand out for me. I'm going to draw something on it and you need to tell me what it is, okay?
8.
An 8. Okay. Other hand.
C.
Okay. Good job. And so I've had him do his grasp reflexes. He's able to follow all commands. The only other thing that I would be able to test is if you will stand right here. Again, turn him this way. Repeat whatever it is that you hear me say, okay?
Eight. S.
Okay.
B. O. 4.
Okay, good job. So the only abnormal findings that I had during my assessment would be the blister that he had on his left foot. Of course, I would evaluate the right foot also to make sure that he doesn't have any wounds, ulcers, any kind of bruises. Do you have any, that's another question you can ask him that you know of. Do you have any open areas? Since he is a 13-year-old boy, I would ask him questions about, do you have both of your testicles descended?
Yes.
Have you had any trouble in that area? Do you have any swelling in your groin? Is there any pain in this area? Does it hurt when you cough, bend over, or lift anything heavy? Those could be all indicative of some type of hernia. He does play sports. He does lift weights. Those are all things that I would want to be sure that I asked him about, especially for a sports physical. And then, anything else? Do you have any other problems that you want to talk about today?
Nothing besides my knees.
Okay, and then he's going to see a doctor because of his knees being tender whenever he went skating the other day and obtained his blister. But right now, all range of motion, everything indicates that it's normal. So also one last thing I'd like to do to test your shoulders and your arms is, can you put both arms out straight? Can you hold them in front of you? Can you place them behind your back? Okay, are you able to do a big circle with each arm? One at a time is fine. What about small circles? Okay, can you lift up in the air without hitting the ceiling fan? Straight up. Okay, straight down. The only other test that I can really think of is especially for a boy, is stand up, turn with your back to me, and bend over. Well, lift your shirt up. Bend over straight down as far as you can. Try to touch your toes. And we're looking for that alignment right there of the spine, making sure that there's no indications of scoliosis or anything there. Also, any kind of muscular cramping or anything like that, you may see a bulge where the vertebrae actually go to deviate to one side. Okay, go ahead and sit up straight due to muscle spasms. While he's turned like this, arms straight, shoulders straight, turn towards the camera. Looking at the symmetry. Nope, straight now. There we go, right there. Looking for symmetry and looking for that midline right there. Anything outside of here, if it was droopy on this side, that may indicate a dislocation. If you see a bulge here, that may indicate that he's got a strained muscle, a pulled muscle, something of that sort. Okay, go ahead and have a seat. And that would conclude my head to toe assessment on Maddox Rodriguez. No other abnormal findings. He's got a little bit of dried mucus inside of his nostrils. That's from, we're all recovering from being sick last week. He's got the one blister on his foot. I would advise him to keep the area clean, keep it dry. If it starts to get too dry, you can put some triple antibiotic ointment on it and keep it covered with a bandage whenever you're wearing a sock. You might want to keep your shoes off in the house for right now and let it get air as much as possible. Okay, return to the clinic. Come back and see me. Let mom know if you have any redness, if it starts having any drainage, if it starts having more pain than it normally does, if it starts getting hot to the touch, if you run any fever, if you have any chills, sweats, anything of that nature, just let us know. Thank you.